Everybody who comes into our clinic comes with a story.
Some of the stories are hard to hear.
Our patients are the people who sit in front of you at church. They're the people who work at the grocery stores. They're the people that we know. And I can guarantee that there are people that come to my clinic that may be your next door neighbor.
I'm gonna die. Serious, I'm gonna die. And it was mentally hurt me also that I got kind of depressed.
I don't meet the criteria of Medicare or Medicaid. So a lot of us are stuck in the shadows.
The reason is my financial problems, and Mexico West, the doctor is cheaper than here, and I can afford insurance here in the United States.
Our mission is to take care of our neighbors, the less fortunate in our communities.
It can be anybody. It can be you, it can be me, because our lives can change in a matter of minutes.
We here see resettled refugees, immigrants, the working poor, people in homelessness.
The demand has continued to skyrocket to the extent that in this last quarter of this year, we have to close our ability to accept new patients.
The percentage of people who are uninsured has not changed significantly, so 20% of 500,000, as we used to be, is a large number. 20% of 1 million is an even larger number. But the need is still overwhelming for those who are medically indigent.
Hello.
Hi. How are you?
Good. It's good to see you.
I think our patients are very complicated and they have lots of struggles.
The barriers that our patients face to care are so vast that I can't believe any of them ever find care. They face external issues such as lack of transportation, jobs that don't allow them any time off, no child care, the list goes on and on.
Okay, now tell him we're gonna look at his ears.
Most of the people are, language problem, and then they need a person where there is very familiar.
Our patients speak a number of different languages. They speak Nepalese, Burmese, Arabic, Korean, Spanish.
People from different parts of country, Bhutan, Nepal, Myanmar, and Middle East.
Our healthcare system, people with healthcare insurance have a hard time navigating it. People that speak English have a hard time navigating it. So I can't imagine what it would look like if you did not know English, if you did not know how to work the system. It would look impossible.
So there's another component that I don't think many people realize is that when patients come to us, that they don't believe that they deserve health care. They're struggling with whether they should even be here. And it's our job to make them feel like, yes, they deserve to be here, that we care about them, that we are going to fight for them, that we're going to be their patient advocate.
We know that we have to be flexible here at our clinic. We have interpreters for those patients that need it. We have a pharmacy on site so that we can make sure that the patients go home with the medicines that they need. We have the dentist here. We have a lab on site because we know there's a barrier of one more stop on the way home. They need to pick up their kids. Let's get it all taken care of under one roof. We realize what the barriers are with our patients, and we do whatever we can to make that barrier go away.
We try to do whole health care. We want to help them with all of their needs. If it's finding rent money, if it's finding grocery money, transportation, to learn English, we will help them find a source that meets their need.
So they are, one, a trusted source, but two, a hub or a medical home which recognizes that medicine is more than just, can I make your sore throat go away?
It's a warm environment. You feel great and you feel love when you come here. It's hard to find it in some of these big places. Without this clinic, I would be dead. I would say dead.
If I didn't find this place, I don't know. Probably maybe I died 2 years ago, so probably I'd be dead.
They gave me another chance to live. And, everybody's like love. That you're walking, you feel better already before you get to the doctor. They treat you like you feel that you are important.
Those who have no insurance or can't afford insurance or can only afford minimal insurance that doesn't pay for anything deserve to be taken care of the same way someone with the best insurance policy is taken care of. They are part of humanity. We are part of humanity. Our job is to make their lives a little less stressful, a little less painful.
I think that the free and charitable clinics are the best kept secrets in the state. We can make a huge impact on our community with a minimal amount of donations.
I do get asked what value do we bring, quite a lot. And it always stops me in my tracks because when I come here and work here and when people give me their trust and their time, I feel like I'm getting the value. I'm the recipient here more than anyone else. Because when someone trusts me, I think there is nothing more valuable than trust.
Their gratefulness makes me sad in the sense that I don't want them to feel like this was extraordinary. And it's an amazing community to be here, and they're important. They are part of our family, and they deserve health care like anybody else.